So bacteria vary quite a bit in pathogenesis. That's pathogenicity. Obviously, not every bacteria has the same potential to cause disease. There's a great deal of variability between one species to the next. Now, some bacteria are just highly pathogenic. It's black and white situation. And a clear example of that is Bacillus anthracis. This is the bacteria that causes anthrax. So this is never safe. If you're exposed to it, it will cause harm because it's highly pathogenic. Now, on the other hand, some are opportunistic, meaning that normally they're fine, they're not bothering you. But if a situation changes, then it can cause a disease. And a clear example of is Pseudomonas. So Pseudomonas, normal individuals exposed to Pseudomonas can deal with it. And we're constantly being exposed to Pseudomonas. And if we're of normal health status, and we'll be okay. But if you have a patient, for example, who has cystic fibrosis, who has difficulty clearing out the mucus from the lungs, and the Pseudomonas infects that patient in the lungs, and it will basically take hold and cause a fairly significant infection within the lung, and it will be hard to clear up. But in a normal individual, if they inhale Pseudomonas, they'll probably be okay. So here's an example of an opportunistic strain, and we'll deal with a lot of opportunistic bacterial species as we talk about these disease-causing bacteria in this course. Now, what determines whether a bacteria is highly pathogenic or not so pathogenic? It all has to do with some power that the bacteria has in order to cause disease, and that power is defined by virulence. So we're going to think about the virulence as the fuel that decides what kind of disease-causing ability that bacteria has. And we're going to have several factors that determine virulence, as we'll see. So let's talk about virulence factors. Now, we can divide up the virulence factors into two different categories. So there's one group of virulence factors that actually has to do with how the bacteria can invade the host. Okay, so these factors will help the bacteria get into the host and stay there and fight off the immune system or even antibiotics. So what are those virulence factors? Well, these are structural things. So we'll talk about flagella. Flagella will help the bacteria move. We'll talk about fimbria. Fimbria will help bacteria attach to mucous membranes. We'll have capsule. Capsule in a bacteria will help it evade the immune system and also make it very difficult to penetrate with drugs. We'll have surface glycoproteins that basically protect the bacteria from the immune system. And then we'll talk about the spores, which is bacteria's ability to create small spores that has all the genetic information that they need. So these spores are basically almost dead. They're not going to be affected by any drugs or anything like that. It's only when they come alive that they will be affected by drugs. But this is the way for the bacteria to hibernate in a sense. So these are structural things that help the bacteria invade the body and stay there. Then we have a second group of virulence factors that are known as that deal with toxicogenesis. And as the name suggests, they produce some sort of a toxin that has an effect on the host. And we can divide up the toxins within bacteria into two groups: endotoxin and exotoxin. And I just want to say that this is one of the most tricky things that students get confused on in antibiotic lectures and in microbiology. Endotoxin refers to just the lipid membrane in gram-negative, the outer lipid membrane in the gram-negative bacteria. LPS stands for lipopolysaccharide. Okay, so I'll come back to it when I talk about the structure of cell wall, but this is the outer lipid layer in gram-negative bacteria, so that's endotoxin. That is pyrogenic. It causes fever because our immune system recognizes LPS and says, hey, there is something wrong. There's an invader and I need to respond. And so the immune system increases the body temperature to fight it off. Exotoxin is actually the toxins that are produced by bacteria. They're synthesized and released by bacteria. And these toxins actually have deleterious effects on the body. So things like tetanus toxin, botulinum toxin, anthrax toxin, and there are many, many more. So the things that are actually produced as chemicals within the bacteria are referred to as exotoxin. And the things that are part of the bacteria, a structural feature of the bacteria that actually causes the immune system to react, is an endotoxin. So don't get confused with these two. Now let's talk about infection types. You can have, let's talk about a couple of definitions that you'll encounter often. One thing is superinfection. So what does that mean? Does that mean it's something really serious? Not necessarily. It can be, but superinfection refers to the whole idea that you have one infection on top of another infection. Or in the process of treating one infection, you created a second infection on top of the first one. So this is usually secondary infection arising after an initial treatment of the original infection. And there aren't that many examples of this, but a clear example of this is, of course, pseudomembranous colitis. So we talked about Clostridium difficile, C. diff, which is often a problematic bug when it invades the GI tract, and typically occurs if a patient has been treated with a broad spectrum antibiotic that wipes out a lot of the native normal flora, and that creates an opportunity for the Clostridium difficile to take hold and cause a more severe infection known as pseudomembranous colitis. This is always a risk with all antibiotics. Some have greater risk than others. If you have an antibiotic that will affect the gut flora more, then that increases the risk, of course. So this is an example of superinfection. Don't confuse this with an opportunistic infection. This has to do with how you treated something and created an opportunity for a second bug. It has nothing to do with opportunistic infections that can occur without a previous treatment with an antibiotic. Okay? The second definition is nosocomial infection. And nosocomial infections refer to infections that you acquire during the hospital stay. So let's say you go in for a hip replacement and you pick up an infection from the hospital after that. And this usually is difficult to treat. So nosocomial infections are typically more difficult to treat because what would you find in a hospital? Well, you got a setting where you have a lot of people coming in with different types of diseases and you're using a lot of antibiotics. So obviously the bacteria that survive in that environment are the ones that are pretty hardy and pretty resistant to normal antibiotics that are being used in communities. So these tend to be more difficult to treat infections.